My name is Scott Weissman, and I work with Genome Medical. And I am here today representing the National Society of Genetic Counselors, talking about the expanding world of germline testing for prostate cancer, the genetic counseling perspective. So prior to getting started, I have a couple disclosures. I am an employee and stockholder of Genome Medical and owner of Chicago Genetic Consultants. But again, for most of the talk today, my disclosures won't impact the information that I will be providing. When it comes to genetic testing for prostate cancer, there was a seminal paper that was published in the New England Journal of Medicine in 2016, where Colin Pritchard at the University of Washington and his colleagues underwent a study where they tested about 700 men with metastatic prostate cancer, unselected for age of onset or family history, and found that about 12% of these men had a germline mutation that potentially could explain their prostate cancer diagnosis or at least indicated increased risk. And of the men that tested positive, they were much more likely to be identified if they had metastatic disease, more so than locally advanced or high-grade tumors. And of the men that tested positive, about 1 in every 4 had actually had a first-degree relative with prostate cancer, and about 3 out of 4 just had any first-degree relative with cancer. So based on this data, about a year later, the NCCN formally recommended that all men with metastatic prostate cancer be offered risk assessment and consideration of BRCA1 and 2 genetic testing. And by proxy, other cancer genes as well, because most of the genetic testing that's taking place these days are multi-gene panel tests. Along the same time, the NCCN prostate cancer treatment guidelines also listed that germline genetic testing should be considered for individuals with prostate cancer. And they also commented about doing some additional genes if you're going to do tumor sequencing. So given the paper and the guidelines, really genetic testing for prostate cancer is booming. Many clinical laboratories are offering hereditary prostate cancer panel tests at this point in time, and they can really be used to help identify the cause of someone's cancer, can help with treatment decisions. So if you identify a BRCA1 or 2 mutation, you may be more willing to maybe consider a PARP inhibitor or a platinum-based therapy. You could potentially identify secondary cancer risks for men that are doing well with their metastatic prostate cancer. And then I think also one of the core components is really being able to then identify other family members that may be at risk of developing cancer. So with the genetic testing boom also comes a need for genetic counselors. And for those of you that aren't aware, genetic counselors are master's level trained clinicians that are licensed as independent practitioners to provide genetic counseling in many states. Genetic counselors have expertise in clinical genetics, genetic test ordering, as well as result interpretation. We also do risk assessment and help people identify patients that may be at high risk that warrant genetic counseling and testing. Genetic counselors are the largest group of healthcare providers in the United States, formally trained in clinical genetics and genomic medicine. And our profession has basically doubled in the past 10 years, and there's now greater than 5,000 genetic counselors nationwide. Generally speaking, our profession is growing at about an 8% per year, and nearly half of the profession practices in oncology. And the reason that this is relevant is that there is a perception that there is a shortage of genetic counselors to help see patients with metastatic prostate cancer or other cancers. And really what is going on is there tends to be more of an access issue, more so than a shortage. So data from our professional status survey really has shown that certified genetic counselors have a new patient appointment within a week, and about 28% could see a new patient within 3 days. Close to the 90% of certified genetic counselors that specialize in oncology report that they can accommodate an urgent patient need within 3 days, and most of them the same day. And the way that we're really kind of dealing with this access issue is that many centers that have genetic counselors are providing this service via in-person or also via telehealth. So either at the institution, or there are many companies that have started to make their way into the marketplace that are offering genetic counseling via telephone or video. And this really allows for an increased access to people in rural areas or generally underserved patient populations. So we're really working on different models to get patients seen to really address this access issue. Another issue that tends to impact access is insurance coverage for genetic counseling. And really, many health plans cover genetic counseling services, even though some institutions are not billing for it. Health plans and healthcare facilities should really be credentialing genetic counselors so that their services can be reimbursed. And on a federal level, the National Society of Genetic Counselors is working with Congress on a bill that's actually been introduced. It's HR 3235 that would make genetic counseling a Medicare benefit by allowing CMS to recognize certified genetic counselors as healthcare providers. Right now, we are not recognized by CMS. And if this bill is able to pass the House and the Senate, this would basically allow for an increased access for Medicare beneficiaries, which again would overall increase access to genetic services. So other things that NSGC is doing to really kind of help increase access to counselors, I already mentioned telemedicine. We're really actively investigating chatbots and other automated assessment tools that can really identify which patients need to be referred for genetic counseling and testing. There are many companies that are popping up that are offering more of a consumer-initiated genetic testing approach where individuals are basically buying their own genetic tests online and it's being signed off by a physician. NSGC is developing triaging tools. So what we're learning is that probably not every patient really needs pre and post-test counseling, and we're trying to develop tools to figure out which individuals really may need the services and which do not. I think most genetics professionals would agree that probably all positive patients really still do need some level of post-test counseling, as well as individuals that have had testing, have tested negative, but they still have a strong personal or family history. There may be other things to consider for those situations. So implementing these different types of tools can allow genetic counselors to practice at the top of their scope and be more efficient and ultimately see more patients to, again, allow greater access to our services. So I'll just close that if you're really looking to find a genetic counselor, we have a website that is called findageneticcounselor.com, where you can search either by zip code, by city, by state, however you want to do it, to find a either local or telemedicine genetic counselor that can provide services to you. And with that, I appreciate your time and you viewing this webinar.